Well, hello, everybody. This is Pam CROMER. I'm a professor at Augusta University, and I'm excited today to talk to you all about the Augusta University Healthy Grandparent and Kinship Care Model, stabilizing families and preparing a future health care workforce. I'm the director of the Costa Lehman International Health Fair Community Engagement Projects at the university, and very happy to share with you all one of our signature projects, this Healthy Grandparent Program. A little bit about the background. More than 2.5 million grandparents in the United States are currently serving as primary caregivers for their grandchildren, often without legal custody, adequate support, or access to health care services. This population experiences high rates of chronic disease, social isolation, and poverty. The Healthy Grandparent Program here at the university addresses these needs through a sustainable, community integrated model that keeps families intact, preserves culture and identity, and promotes health and stability. This collaborative, patient centered initiative supports grandparents raising grandchildren in parent absent homes. The program aims and objectives is that the Healthy Grandparent serves as a high impact learning environment for nursing students, offering experiential learning in community health, health equity, and interprofessional teamwork. Learning objectives include demonstrating community assessment, applying evidence-based interventions, and evaluating outcomes for families experiencing kinship caregiving. Our goal is to prepare a future workforce of nurse practitioners and other nurses to experience the real world of population and public health, providing community-based health care to vulnerable populations, and in this case, our healthy grandparents. So the methods that we use with this program is that we have a faculty-led, student-implemented intervention integrated into the community health curriculum through service learning and reflective debriefing sessions. Learners examine how interdisciplinary collaboration, inclusivity, and holistic care address systematic gaps in family support while engaging in discussions of challenges and community engagement strategies. So today's objectives with this presentation is to describe the interdisciplinary care model used by our Healthy Grandparent Program and to examine and apply insights from the program structure to inform development and enhancement of family-centered programs. Pictured here, a little blurred picture, but he's very important to this program. This is Mike Patton, our social worker. He's our research associate for the program, and I want to give him utmost credit for helping to prepare this PowerPoint and for a lot of the data points that I'm going to be sharing. So the outline that I'm going to follow today is talking about the national data and trends, giving you an overview of our Healthy Grandparent Program, a little bit of facts about high school dropout rates, the focus of our interventions, our challenges, the benefits of the program, its outcome, and resources. So let's just go ahead and start with the national trends snapshot. Nationwide, there's about 2.7 million children in kinship care. That means 2.3 grandparents are serving as caregivers. 60% of those grandparent caregivers are remaining in the workforce, and 21% live below the federal poverty level. The highest grandparent concentration where they're raising their grandchildren is in the South and in the Southeast. So why does this matter? Because this puts a lot of chronic stress on those caregivers, financial stress as well as workforce strain. And there's an increase in health disparity among this population, a definite need for family-centered and trauma-informed care. In Georgia, there's about 125,000 grandparents serving as caregivers, and 110,000 grandchildren live in parent-absent homes, living with their grandparents. Georgia ranks the sixth highest in the nation for grandparent-led households, and 27% of those caregivers have been providing that care for over 5 years. 65%, a little over 50%, are under the age of 60, and 58% are in the workforce in Georgia. 2,000 plus grandparents are raising their grandchildren in the counties around our academic medical center, Richmond, Columbia County. So our Healthy Grandparent Program, a little bit of history, began in 1999, focused to provide physical, emotional, and social support to grandparents who were raising their grandchildren in parent-absent homes. The goal was to support grandparents in their efforts to provide their grandchildren with a stable and permanent home while maintaining family ties and cultures and keeping the children out of the formal foster care system. So, about 27 years old, we have to date served 690 families, almost 1,000 grandparents involved, with about 1,500 grandchildren. We are one of two academic, university-affiliated healthy grandparent programs in the state of Georgia, providing physical, emotional, and social support to the grandparent and great-grandparents raising their children ages 0 to 17 who are living in parent-absent homes. The program is sustained through annual renewable service grant funding sources that require matching funds from the College of Nursing. The characteristics of some of the families we served, most of them are headed by single grandparent, at least 60%. Again, half of them are working. The average age is 53 when they begin to be involved with this kinship care. Half of them are raising more than one grandchild, and at least a fourth of them have 3 or more grandchildren that they are raising. Characteristics of the grandchildren is the average age of the child when began living with the grandparent is about 4.5 years. Children have little or no contact with their birth parent, and about a fourth of them have been raised by grandparents since birth. 57% of them have no legal relationship with their grandparent, and 5% receive child support from their birth parent. Now, that 50% with no legal relationship with their grandparent is very significant, because as a parent, you know that when you enroll your child to school or for a lot of things that they are eligible for, it means that a person who has custody or guardianship must be signing for some of the services that they're eligible for. So that's quite a number to hang on to as we work through this, that 50% of these have no legal relationship with their grandparent. That's significant because in our team we have Jacqueline Thomas, who is an attorney with one of the law firms downtown, that helps us attain that legal relationship, providing for custody and for adoption in some cases, and that's her picture here. So what are the reasons these children end up in our grandparent program? A list of these things. You see abuse, child abandonment, neglect, the death of a parent, physical or sexual abuse. Parents have mental disorders, parents that are incarcerated, teenage parents, domestic violence, and alcohol abuse. All of the trauma factors that we learn about related to adverse childhood experiences is what leads to this. And we know that high school dropout factors are an important thing for the health and well-being of our nation and for these children. And so what we know is that 1.2 million typically drop out of high school annually within our nation. And our graduation ranks about 19th worldwide. The research says that there are high predictors of dropout, and they are because of moderate to high absenteeism from school, behavioral problems, no school or outside activities that kids are involved in, and 94% of young murder victims are drop out from high school. Some of the social factors that we know about within the literature is that racial and ethnic minority groups versus white students have a higher risk of dropout. Low-income families, single-parent households, and where one or both parents did not complete high school are also involved with some of those stats. So some of the academic risk factors is, again, high absenteeism, failing grades or grade retention, being in academic trouble, and being disengaged from school life. And because of the factors that I just reviewed with you, the ACEs here, the abuse, abandonment, etc., you can see where absenteeism or behavioral problems can come to be an issue to address. Personal reasons to drop out of high school exist as well. A lot of these kids will drop out to go to work because of bullying. Family emergency situations create situations where kids drop out of school nationwide. A lack of freedom, depression, mental illness, unexpected pregnancies, a bad environment, and boredom are some of the personal reasons that are found in the literature. And consequently, dropping out of school leads to, or not graduating high school, leads to long-term economic and social repercussions. These kids are more likely to be unemployed adults, homeless, welfare recipients, or incarcerated. So, moving to our Healthy Grandparent Program structure, we take pride in the fact that we provide an integrated community resource service to enrolled families for our program. We have a full-time social worker on board, a legal counsel attorney. She practices pro bono for most of her work. The social worker does a great deal coordinating and serving as our support advocate for educational, health, mental health, adoption and custody, and legal affairs, working very closely with that attorney. We also have within the structure our monthly support group meetings, and they are sometimes led by student cohort trainings from our Children's Center Child Life program, our baccalaureate and our DNP students, and our communication majors here at the Augusta University. With this, our students are very involved with age-appropriate activities, mentoring the grandchildren, education sessions for the grandchildren, the grandmothers, the grandfathers, and any visitors that they may bring. Research and marketing is also conducted by our communication majors. There's a lot of mentoring that goes on. We have, again, education sessions that are tailored to what the grandparents tell us that they would like to learn about in terms of parenting, in terms of communications, or how to deal with behaviors and that kind of thing. And our research and marketing of the program is done by our communications majors as well, conducting researches and giving us information on how to best go about providing the data, marketing, and looking at grants for funding for this endeavor. The other structure that is important in this program is that we conduct seasonal and special events for our families. A lot of these are sponsored by community and professional organizations and a lot of in-kind donations. Some of the focus of the healthcare program interventions is to address the needs of the family as a whole and not just the grandparents, acknowledge the unique way circumstances and history has on each family, to address healthcare, emotional, and mental health care needs of both the grandparent and the child, and to offer grandparents counseling, referrals to other outside supports, and allow grandparents time to vent and create support networks, if possible, among those who are enrolled and come to the support meetings. We work closely with the grandparents to help them understand the effects of trauma, to encourage them often. Many have doubts about the future and their own capabilities. We also focus on moving the family forward and don't get stuck in the past, to empower the grandparents and make them feel a part of the process, and to help them to be aware of birth family involvement and its impact on the family and the possibility of disruptions, how to deal with that. The services provided, we have a needs assessment link with our families to community resources and information. Again, monthly support group meetings held on campus, a yearly grandparent and grandchild physical and health education clinic for both the grandparent and the grandchild, and the child custody and adoption assistance. Our social worker does actual regular school visits for children who are having behavioral and academic problems, and of course, works with the families to help get those resolved and get the resources that students may need that are going through this behavioral situation at school. Our community resource guide links our providers to the community resource, and we make sure that every family has that. We have a book bag school supply donation that is provided to each grandchild every school year, and we have financial assistance for after school enrichment activities, childcare for single working grandparents, and summer camp to include respite camp for the grandparents as well. Then our students are a major part of the grandparent program. We are all about providing experiential learning or service learning for our nursing students at all levels. It gives them a hands-on approach with skills and knowledge that they can gain by doing, by experiencing and reflecting on real-world situations. And it allows them to apply theories in practice. For example, internships, research, or projects develop deeper understanding and new competencies as we find projects and ways that we can engage our students. But what we do center on is repetitive cycles of concrete experience, reflective observations, abstract conceptualization, and active experimentation, which fosters critical thinking and real world readiness learning for our future workforce. So David Cobb is very big on experiential learning cycle. This is a natural and organic way that people engage in life situations, often without being aware that they are learning. The cycle is composed of two pairs of opposite ways of grasping information, experiencing and thinking, and then transforming it into knowledge and reflecting and acting. Most people have preferences for the way they use this learning cycle, and it focuses on some modes more than others. When one engages deliberately with all four modes of experiential learning cycle, deep learning can occur. And so experiencing, reflecting, thinking, and acting are the experiential cycle that we work with our students. And we realize that they all have different learning styles and characteristics. Some of our students are analytical, some are thinkers, some are experiencers.
Some have an imagination and reflecting style. Whatever it is, our students are moving in and out of those concepts for learning and engaging with these families, and we recognize that and teach them that it's very good to sit back and realize how learning occurs. There is a website here, and you will have access to this PowerPoint that I refer you to if you are interested in any short video reviews or principles of learning. And that's what this slide is about. So I make that available to you. It talks about learning being an endless recurring cycle and not a linear process. Experience is necessary for learning. The brain is built for experiential learning, and the didactic poles of learning cycles are what motivates learning. Learning styles are different ways of going around the learning cycle, and the full cycle learning increases learning flexibility and development. Teaching around the learning cycle with dynamic matching of the teaching role as a facilitator, a subject expert, a standard setter, evaluator, and coach. The learning cycle can be a rubric for authentic, holistic assessments, and we find this to be very important with this program. The conceptual framework for integrated healthcare program is for concrete learning experiences, reflective observation, abstract conceptualization, learning by analyzing and forming ideas, and active experimentation by testing and applying what they've been learned. Some considerations for family health and public health delivery is to engage the individuals as partners, being our grandparents and our students, and our team in decision making and care planning, assesses the assessment of the need of the entire family unit, providing education and resources, fostering open communications and integrating services, evaluating outcomes collectively to improve the family health and well-being of our enrolled families. Some of the strategies that our grandparent program provides, first of all, is funding for Healthy Grandparent Program comes from DHS's Promoting Safe and Stable Families program and our CSRA Area Agency on Aging. The grants have sustained us for 27, this will be our 28th year. Again, with the embedment of the experiential learning module curriculum, the University Community Engagement Outreach Initiative. This was one of the signature projects that helped to gain Carnegie status for our university this year, which means that we are definitely having a reciprocal relationship within our communities and impacting that for healthier communities and student learning benefits at the same time. And we have this dedicated and committed legal counsel. So with the grant, the university at the top level supporting it, our students learning with the curriculum-based model that we use, and having our legal people involved, it's a wonderful strategy that has helped so many of our families through the years. This is a picture of the place where we actually once a year come to for our clinic. We rent this space and set up booths. The community resources come. Our students at different levels come, and we provide healthcare services, 1 day for the grandparents and 2 days for the grandchildren. Particularly for the grandchildren, this summer we're going to be focusing on sports exams and back to school exams. We have our East Central Georgia Regional Healthcare Coalition that joins us, and just based on that name, you can see that there's different types of community resources that are representative and available to our families on this day, with contacts for further engagement once the clinic day is over. We also bring in a mobile health clinic from our local health department where we can catch our grandchildren up on their immunizations, and grandparents can also receive age appropriate immunizations that they may not be aware that they need as well. This is just a picture inside of how we have set up booths. This is just a small part of it. Here is a group of one of our student groups posing for a picture, so you could see that they look happy and they were very engaged this year. This is a picture of them doing blood pressures. And so the benefits to Augusta University for our grandparent program is increased visibility, awareness, and community engagement for our university, for the College of Nursing, its students, and our integrated healthcare teams. The Healthy Grandparent Program has received referrals from over 50 different community agencies. So we do have a good source of resources for these families. Another benefit is that we have built trust and credibility in the community for AU and the College of Nursing through this program. We provide increased opportunities for networking and shared resources for the enrollees, and we have improved and expanded our service array for our families, creating a sense of shared purpose between DFACS, the court systems, the school systems, and an aging community. We're fostering more opportunities to create a safety net and effective healthcare solution within our community, and AU was accepted for Carnegie status using the Healthy Grandparent Program as one of its signature community outreach programs this year. We also have published the first ever comprehensive study on the educational performance of grandchildren raised by their grandparents in K through 12. So scholarly output for demonstrating our effectiveness with our students and visibility in the literature. So the benefit to the community is about 1,500 grandchildren in the CSRA have permanency in a safe and stable home. The children are able to maintain their family ties and culture instead of growing up in the formal foster care system. It's lessened the burden on an already overwhelmed child welfare system, and we have increased school attendance and high school graduation rates, low rates of juvenile crime and teenage pregnancy, increased community awareness and support for the grandparent caregivers, breaking the cycle of child abuse and neglect, increasing families' access to resources and expanded service array for these families, and an ever-increasing interest in participation of healthcare professionals and community workers at planned events. So overall benefits is access to care, established resources and networks to stabilize the units, the family unit, opportunity and support to broken and fragmented families, education and training of future healthcare providers with real-world experiences, community engagement, professional podium presentations and publications, expanding the brand for respectful and compassionate holistic care, and a partnership with a family law firm for full legal custody and adoption services. So in 2024, we had 42 grandchildren that went through the legal system and adoption of 3 grandchildren. And we're very proud of those statistics. Some of the outcomes and resiliency that it has been demonstrated, 93% of children have remained in their grandparent care unit up to age 18. Only 3% have returned to live with their birth parent. School attendance and graduation rates are very high within the program, and low teenage pregnancy rates and low juvenile crime rates. We know that the families that are enrolled have very strong faith, and most of them are heavily involved within the churches where they're members. We have reduced non-custodial relationships by 34%, increased adoptions by 11%, and only 6 children have been removed by defects due to abuse and neglect. Some faculty identified challenges and sources of stress is that the grandparents themselves are often unfamiliar and frustrated with systems such as the school, the mental health, DFACS, legal, and housing. And those enrolled in our program, little by little, they are able to connect and get stabilized in these particular areas. We give them access to information and help them with developing relationships and engagement with the appropriate resources. Social isolation for grandparents and grandchildren is another identified challenge. Few outside resources and no break from caregiving for the grandparents. And the grandparents are assuming the raising of their grandchildren, and they put that as a priority, often sacrificing their own needs for their grandchildren. Another challenge or source of stress is caring for children with special needs, both physically and mentally. 45% of children have a diagnosed mental, physical, or neurological disorder, or children's behavior problems at home and at school. Another thing to think about is chronic health conditions of the grandparents themselves. A lot of them, diabetics, hypertension, high cholesterol, heart attacks, all those things that they deal with, along with the added stress of young children that they did not think that they were going to have to be raising. 77% of the grandparents have been diagnosed with chronic health problems. Some more challenges are the lack of financial resources because most of them are living on fixed incomes, and then they may have to go back to work or delay their retirement. Um, some of them, childcare for working single grandmothers are an issue, and few receive child support, and the cost of food is expensive. There is no legal custody access to the court system. The financial cost and unfavorable child custodian laws is a challenge, but our social worker, working closely with our legal system, has really done a fine job of making sure that we get those kids guardianship, custody, or adoption. And again, remember the attorney that's involved with us does her work pro bono. Family dynamics and disruptions are caused by the parents. Oftentimes, the parents come in and out of the children's lives, and the parents often have broken promises repeated, and it often disappoints the children and exacerbates problems behaviorally and personally for these children. A lot of them are dealing with multiple parents. The difference between who is the person that is in charge of them? Is it the grandparent? Is it the parent? So the relationships in those homes are critical elements that our social worker deals with, and resentment from other family members because a grandparent family may have multiple children and they are upset that the grandparent took this on as a responsibility. So these are just human problems that we're dealing with this population. Significant mental health concerns. 18% of the grandparents are diagnosed with mental disorders of anxiety, depression, which are most common. 39% of the grandchildren have a diagnosed mental health disorder, such as ADHD, depression, autism, bipolar, any of those things. The grandparents and grandchildren are also dealing with the same strong emotions such as anger, depression, grief, anxiety, and resentment, and both feel caught in the middle with parents. 52% of the children have confirmed child abuse, neglect cases by DFACS. 47% are placed with their grandparents by DFACS, and 15% are placed in foster care before living with their grandparents. Many grandparents have no time to prepare for life-changing responsibility. So our community partnerships are extremely important. Again, legal assistance, attorneys, yearly physicals conducted by our College of Nursing faculty and their students. The Georgia Legal Services are assisting grandparents with living wills and testaments. Individuals and businesses provide gifts for Christmas, book bags, school supplies. And we have a project, Linus, that provides handmade blankets to each grandchild, area agency on aging, yearly funding for camps, farmers market vouchers, numerous churches for food, clothing, and seminars. Safe Kids East Central Georgia provides child car seats and bike helmets. Our co-age rep, Brian Prince, and Representative Jesse Stone was responsible for the Equitable Caregivers Act, which really has impacted our program. And numerous individuals and organizations have provided over 135,000 in donations and small grants annually. So the impact in the year 2025, we served 86 families, 124 grandparents, 153 grandchildren. Nursing students provided healthcare screenings and education on childhood diabetes, allergies, nutrition, and vaping hazards. 50 families received summer physicals. A new grandparent-focused clinic was launched. 42 grandchildren gained legal custody placement, and 3 were adopted with health grandparent support. The AU Communications Department launched marketing and research courses designed to support the healthy grandparent as well. So we were very active and had high impact in 2025. The implications of this program is that it can be replicated. It's an innovative model that advances health equity, strengthens family stability, and prepares future nurses with experiential learning to provide compassionate, community responsive healthcare practices. So, in summary, we're now in our 27th year, moving to 28. In fact, this summer makes our 28th year. The Healthy Grandparent integrates healthcare, legal aid, social services, student-led interventions that stabilizes families and reduces foster care placement. In conclusion, there is a rising and urgent need for safety net for grandparents and kinship care services. Academic medical centers are poised for creativity in student training and education to support these vulnerable populations. Here are our references. And with that, thank you for attending this session. And if you need more information, again, I can be contacted at Augusta University, pcromer@augusta.edu. Thank you very much.